actually in quite a unique place in Sainsbury's. It's quite nice. The equipment, the surgery is state of the art. Our patients love it, I think, and that's the most important thing. As a dentist, you want to make it easy for patients to come to visit you. So we have secure car parks, bright lights, late opening hours, so that the patient can actually come in to see you. I think that removes one barrier for patient care, and I think most dentists will actually jump at the ability and the chance to work in Centre for Dentistry in a shopping centre in Sainsbury's. I think it's actually quite nice. No, it is totally self-driven dentistry, and again, so from a GDC perspective, that is now changing. So they are asking dentists to think a little bit more about where they're going in their career, not just do a CPD course if they have a Friday off or something like that. The GDC want you to be more proactive in planning your development. And I think that's what we're doing at CFD as well. We're looking at, okay, where do you want to go as a dentist? Where do you want to be in 5 years? How can we help you get there? I think that's quite nice. Just in terms of sitting down and actually verbalizing the ideas of where you want to go in your career. Not many people do that. So it is doing a personal development plan with myself or whoever is quite a nice exercise. It's an aspirational kind of, okay, where do I want to go? We're often too busy kind of thinking about where we are and the daily stresses, as opposed to, okay, what's the plan? What's the goal? I think within dentistry can be quite isolated as a profession. You are in your surgery, this is it. So it is quite nice to get support and build a community outside of the surgery. I think there's a lot of different benefits from that, from just a support from a social aspect. Dentistry can be a little bit antisocial. Even though you see so many different people throughout the day, it's not exactly a social profession. So it is quite nice a nice aspiration for us to build a community. By building the community, I think there's some incredible assets within our company in terms of people. Some of our dentists, some of our specialists are incredibly skilled individuals, and they bring a unique perspective. So by building a community, we can actually all share in their abilities and learn from them. At Centre for Dentistry, we offer quite a few different materials in all the different aspects. So in terms of composites, we've many different types and many different shades, etc. If there is something then that you feel that you absolutely need, that is just a case of putting it on the materials tracker, asking your clinical director, and explaining why. What's the benefit of this? Is it scientific? Is there a performance issue, or why a certain material is required? But if there are certain materials that you feel that you absolutely do need, that is just a conversation to have with me, and we can look at getting you that. In terms of equipment, again, we're pretty well stocked out for equipment. We have rotary endo, digital x-rays, screens in the surgery for the patients, intraoral cameras. We have pretty much everything that a high quality private practice will need, and we're looking at getting more and more equipment as we move on. Lucky enough to tour some of the labs, and some of the work that they create is absolutely top quality. So it's quite nice. At the moment, we have a labs list probably of a number of different labs that we can go to, that we can send different works to depending on your preference. I think it is nice to have a little bit of choice as well, to know what lab you feel best works with you, what lab technicians you communicate the best with, and we have access to all of that at CFD. One of the things that we do recommend is time, in terms of, firstly, the emergency appointment is not squeezed in 5 minutes before lunch. It should be a 30-minute appointment where you have the time to actually have a conversation with the patient and to understand their issues, their dental pain, their previous history, etc. That you can have the conversation that, okay, we might be better off not doing an extraction today, and we might be better off doing something, primary root canal treatment, or opening up a pulp. So it's important to have that time to have that conversation. I think that's what we can offer with Centre for Dentistry. Record keeping is something that is done after the fact, after you have seen a patient, you've done the work, and it's kind of an afterthought. That's probably a perception of many clinicians, but unfortunately it can't be the reality, because record keeping should take almost as much time as patient care. It's really important to keep accurate, up-to-date records of everything, because if anything goes wrong, you need something to fall back on. In terms of referring, you want to have all the information there so that the referred patient knows the treatment that they need, etc. It is thoroughly important to make sure your records are up to date and very, very accurate. With our patient base, we see a lot of patients who haven't been for quite a few years. So a lot of patients have quite high needs. If you look at the treatment that they will need in the coming years, it's quite considerable. So in terms of how do we provide that treatment in the best possible way to the patient is an interesting challenge. One of the things that we recommend is, okay, first of all, you should look at stabilizing everything. So if there's active periodontal disease, open cavities, that should be looked at stabilization first. So provisional restorations, hygiene appointments. Then once that's stabilized, then you can come back and look at doing routine restorative care. And then once that's sorted, come back and do advanced restorative care, implants, things like crowns, etc. And it's important to break that up into bite-sized or achievable plans for the patient, because if you put everything down on one plan, you will terrify the patient, they won't come back. And that's not in the patient's best interest. That's the key factor. Communication is more than verbal. Most communication is how you act, how you interact, your enthusiasm, your demeanor. So it's quite nice to see that. That's one of the key things for me. I think clinically, there's certain things that we're looking for. Want to make sure that yes, you are using rubber dam for all root canal treatments. Yes, your standard of care is top class, and you are aware of the latest guidelines and you work towards those guidelines. But aside from that, it is down to communication. It's down to person-to-person skills. I look at how you react or act in an interview as how would you react in a patient setting. So how do you speak with your patients? How do you communicate? So it's your style. That really is a key factor for me.